Bismillahirrahmanirrahim. Quote of the day. Nothing is impossible. The word itself says, I am possible. Today, the topic of my presentation is gonorrhea, and I am presenting it under supervision of my professor, Dr. Sainam Sai. Learning outlines. Introduction, epidemiological triad, chain of transmission, levels of prevention, and recent advances and MCQs in the end. Learning outcomes. By the end of this presentation, participants will be able to describe gonorrhea, its epidemiological triad, prevention, and recent advances. Case study. A 26-year-old male patient came to the dermatology clinic, District Hospital ABC, complaining from severe burning sensation during urination and dysuria for 4 days. Additionally, he was suffering from penile discharge and testicular tenderness. He had a history of multiple heterosexual relationships with the last contact 8 days ago. On physical examination, vital signs showed blood pressure 110/80, pulse 75, temperature 37.6 degrees centigrade. There was mucopurulent cloudy discharge from urethra, swollen testicles were also observed. Following counseling, urethral and ocular swabs and blood sample was aseptically obtained and streaked immediately on hermatin chocolate agar plates and incubated overnight. Following the incubation period, grayish-white, transparent to opaque, slightly raised colonies with 1 to 2 micrometer diameter were observed after gram staining pink to red diplococci with coffee bean-shaped cells opposing each other on the concave sides. This result was sufficient for the presumptive identification of Neisseria gonorrhea. Now, what is gonorrhea? It is a bacterial infection caused by Neisseria gonorrhea that causes urogenital, anorectal, conjunctival, and pharyngeal infections. Urogenital tract infections are most common. It is second most frequently reported bacterial sexually transmitted infection after Chlamydia trachomatis. Co-infection with Chlamydia trachomatis is common. Gonorrhea is also sometimes called the clap or the drip. It is very common, especially among young people aged from 15 to 24 years. Classification. First, we have gonorrhea of urogenital organs. That is genital type. Second is extragenital gonorrhea, which includes gonorrhea of mouth, rectum, pharynx, tonsils, eyes. Third is metastatic, disseminated, which is a complication of first two types. Problem statement. Gonorrhea is sexually transmitted infection that remains a major public health concern. WHO estimates that in 2020, there are 82.4 million new cases infected among adolescents and adults aged 15 to 49 years worldwide, with a global incident rate of 19 per thousand women and 23 per thousand women. Most cases were in the WHO African region and the Western Pacific region. So if we see the prevalence among men and women, so we can see that it is highest in the WHO African regions, then we have Americas, Western Pacific, and lowest in Europe. Incidence was also highest in the WHO African regions, Americas, Western Pacific, and lowest in the European region. Epidemiological triad. We have agent, which is this gonorrhea is caused by gram-negative diplococci, Gonococcus Neisseria gonorrhea. It is shaped like coffee beans, concave surface facing each other, and Gonococcus main pathogenic organism adapted to destroy mucous membrane covered with columnar epithelium. In patients' body, gonococci often undergo cell transformation after using chemotherapeutic drugs. Host, the natural host we have is human. Environment. Organism is fragile and cannot survive outside of human host, affected by temperature changes, drying, UV light, and other environmental stresses. Organism cannot be transmitted from clothing, toilet seats, or household utensils to healthy person. Organism can affect any sexually active person even if they are healthy. Mode of transmission. It is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner, perinatally from mother to baby during childbirth. Here we can see that source we have, that is the carrier is human, and the route is sexual fluids, and target is healthy susceptible person. Incubation period. It is 1 to 4 days, 14 days, and onset of symptoms usually occurs in 2 to 8 days. Risk of factors. These are the risk factors in adults, that is age younger than 25 years, black race, history of gonococcal infection, other STIs, inconsistent condom use, men who have sex with men, and substance abuse, and in children, mothers with a history of sexually transmitted infection or substance abuse, mothers without prenatal care, and not receiving ophthalmic prophylaxis at birth, and sexual abuse. Pathogenesis. The infection occurs when there is attachment of the bacteria to host cells, and then their corkscrew movement takes place and they travel to lymph nodes. In perivascular lymphatics cause and arthritis, obliterans, loss of blood supply, and ultimately leading to genital ulcers. Clinical features. In men, it causes discharge, pain or swelling between the thigh, that is in inguinal region, burning or painful urination. In women, it causes vaginal discharge, burning or painful urination, pain in the lower abdomen, abnormal bleeding from vagina or anus. Infection in men. Men with gonorrhea usually are symptomatic, but asymptomatic urethral infections may occur in at least 10% of cases. Common silent symptoms include dysuria and purulent penile discharge. Unilateral epididymitis without discharge is also present. Chlamydia causes 15 to 40% of non-gonococcal urethritis cases in men, and 1 to 2% of men who have non-gonococcal urethritis develop sexually acquired reactive arthritis. Infection in women. Untreated gonorrhea causes 10 to 20% of pelvic inflammatory disease cases. 15% of women with PID develop infertility from tubal scarring. CDC recommends that symptomatic women should be examined for pelvic inflammatory disease by palpating for cervical or nasal tenderness and tested for gonorrhea, chlamydia, bacterial vaginosis, and trichomoniasis with endocervical cells for light microscopy and nucleic acid amplification testing. Infections in infants. It can occur in neonates from exposure to infected cervical secretions during delivery. Neonatal conjunctivitis treatment is important because treatment prevents globe perforation and blindness. And in infants lead to arthritis, pharyngitis, rhinitis, vaginitis, urethritis, localized scalp infection or abscesses, sepsis, and meningitis. Prenatal screening and treatment of pregnant women for gonorrhea is the best method for preventing Neisseria gonorrhea infection among neonates. Disseminated infection. Disseminated gonococcal infection is rare, affecting 0.4 to 3% of patients with gonorrhea, and it includes skin infection, tenosynovitis, and septic arthritis. Rare disease progression may result in perihepatitis, meningitis, endocarditis. This is a picture of disseminated infection that is involving oral cavity, hands, joints. Complications. Complications of the gonorrhea are pelvic inflammatory disease that is occurring in females, and epididymitis. This may lead to infertility. Disseminated gonococcal infection. It is usually characterized by arthritis, tenosynovitis, and dermatitis. Levels of prevention. Primary prevention, we have health promotion, specific protection, health education about abstaining from sexual activity, increased condom use, increased sexual education, increased routine sexually transmitted infection screening. Specific protection. No currently licensed gonococcal vaccines exist. However, interest in gonococcal vaccine development has been reinvigorated not only by the marketed increase in gonococcal antimicrobial resistance, but also by mounting scientific data suggesting gonococcal vaccines are biologically feasible. Secondary prevention. We have early diagnosis from treatment. Early diagnosis. It is done through testing urine, urethral for men, or endocervical or vaginal for women specimens using nucleic acid amplification testing. This NAT test is most tentative to detect urethral gonorrhea even in asymptomatic men. Gonorrhea culture, which requires endocervical or a urethral swab specimen. If a person had oral anal sex, pharyngeal or rectal swab specimen should be collected either for culture or for NAT test. Treatment. Gonorrhea is treated with antibiotics. Treatment is recommended for a person who has a positive gonorrhea test, and anyone who has a sexual contact in the past 60 days with a person diagnosed with gonorrhea, whether or not they have symptoms or used any protective barrier. So this is a update to CDC's treatment guidelines for gonococcal infection. The main treatment for this infection is antibiotics, and CDC recommends a single 500 mg intramuscular dose of ceftriaxone for uncomplicated gonorrhea. And treatment, if a person is co-infected with chlamydia trachomatis, then we give oral doxycycline 100 mg twice daily for 7 days, and this is administered when chlamydia infection has not been excluded. Update to CDC's treatment 2021. Regimen for uncomplicated gonococcal infection of the cervix, urethra, rectum. If a person's weight is less than 150 kg, then ceftriaxone 500 mg IM is given as a single dose. And if chlamydia infection has not been excluded, as we have already talked, then we give 100 mg orally twice daily for 7 days. And in pregnancy, azithromycin 1 gram as single dose is recommended to treat chlamydia. Otherwise, in pregnancy, same treatment regimen is given. Alternative regimens for uncomplicated gonococcal infection of cervix, urethra, or rectum if ceftriaxone is not available. Then gentamicin 240 mg IM is given as a single dose plus azithromycin 2 gram orally as a single dose, or cefixime 100 mg orally as a single dose. And recommended regimen for uncomplicated gonococcal infection of the pharynx. In this, we give ceftriaxone 500 mg IM as a single dose for persons weighing less than 150 kg. And if a person weighing greater than this weight, then 1 gram of IM ceftriaxone is administered. And again, if chlamydial co-infection has occurred, then doxycycline is given. HIV co-infection. Persons who have gonorrhea and HIV infection should receive the same treatment regimen as those who are HIV negative, because having a gonorrhea infection puts a person at a great risk for contracting HIV. So gonorrhea can spread to the blood or joint. So the same treatment regimen we have discussed previously is given to the in cases with HIV co-infection too. Ophthalmia neonatorium prevention and treatment. Recommended regimen to prevent ophthalmia neonatorium. In this, erythromycin 0.5% ophthalmic ointment in each eye in a single application at birth. And this is the prevention. This is for prophylactically it is given. And for the treatment, ceftriaxone 25 to 50 mg per kg body weight IV or IM in a single dose is given to the infant. Pregnancy. Pregnant women infected with Neisseria gonorrhea should be treated with ceftriaxone 500 mg in a single dose plus treatment for chlamydia if infection has not been excluded. Antibiotic resistant Neisseria gonorrhea. What is antibiotic resistant gonorrhea? It is the ability of bacteria to resist the effects of the drugs used to treat them. This means the bacteria are no longer killed by a drug that used to kill them before. So the bacteria cause gonorrhea, which has grown resistant to nearly every drug ever used to treat it, and it's only a matter of time until it becomes resistant to the last available cure. And 1.6 million, according to CDC, it estimates that 1.6 million new gonorrhea infections occur each year, and that half of those infections are resistant to at least one antibiotic. Gonorrhea has progressively developed resistance to the antibiotic drug prescribed to it following the spread of gonococcal fluoroquinolone resistance. The cephalosporin antibiotics have been the foundation of recommended treatment for gonorrhea. But unfortunately, the emergence of cephalosporin-resistant gonorrhea significantly complicate the ability of providers to treat gonorrhea successfully. Causes of this resistance: unrestricted access to antimicrobials, inappropriate selection and overuse of antibiotics, and poor quality antibiotics. Genetic mutations within the organism have contributed to increase this drug resistance. Infections outside of the genital area, like in the throat, rectum, particularly affect key populations such as men who have sex with men. This may also play an important role in the development of resistant strains such as Neisseria gonorrhea, and interact and exchange genetic material with other organisms in these parts of the body. WHO response. WHO is implementing the Global Action Plan to control the spread and impact of antimicrobial resistance in Neisseria gonorrhea to facilitate the effective actions against the spread of multi-drug resistant Neisseria gonorrhea. The key WHO actions are effective prevention and control of gonococcal infection using prevention messages, interventions, and appropriate treatment regimens, establish effective drug regulations, strengthen surveillance systems from antimicrobial resistance, especially in countries with a high burden of gonococcal infection, establish regional network or laboratories that can perform gonococcal culture with good quality control mechanisms, monitor treatment failure, support of research to find low-cost tests to identify this bacteria and develop methods for detecting antimicrobial resistance and research into alternative treatments for gonococcal infection. Screening. CDC recommends yearly gonorrhea screening for all sexually active women younger than 25 years, as well as older women with risk factors such as new or multiple partners or a partner who has sexually transmitted infection. Routine screening for gonorrhea and other curable STI should be performed at least annually in sexually active patients with HIV infection. Screening for urethral infection should be performed with urine NAT test, whereas rectal or pharyngeal screening should be performed with nucleic acid amplification swab test. Screening every 3 to 6 months is also recommended for men who have contact with men if they have multiple, because they are at high risk of contracting STIs. Uninfected pregnant women who remain at high risk should be tested during the third trimester. This is the gonorrhea by age in 2018. This is the statistics of US. The highest rates among females were observed among those aged 20 to 24 years and 15 to 19 years. And among males, the rate was also highest among those aged 20 to 24 years with 720 cases per 100,000 males and 25 to 29 years with 674 cases per 100,000 males. And the rate among blacks was 7.7 times the rate among it was highest as compared to the whites. And this is the overview that 1 in 5 people in the US have an STI. And we have seen that US is the state where people with Neisseria gonorrhea are more prevalent, and totally nearing 68 million infections in 2018 and 26 million new STIs in 2018, and almost half of these were among those who had age group of 15 to 24 years. And new STIs totally nearing, this is the cost, medical cost that has been spent in these expenditures, that is $16 billion in direct medical cost. In Pakistan, we have National AIDS Control Program. The heterogeneity and interlinking of high-risk injecting and sexual behavior combined with low levels of HIV knowledge and prevention and high levels of other sexually transmitted infections. A few of the main objectives of this program are prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted disease transmission, and establishment of surveillance. Recent updates. This is an article on antimicrobial resistant Neisseria gonorrhea and treatment of gonorrhea. Gonorrhea and antimicrobial resistant Neisseria gonorrhea are major public health concerns globally. Dual antimicrobial therapy, that is ceftriaxone with azithromycin, is currently recommended in many countries. First global treatment failure with recommended this dual therapy was reported in 2016, and the first isolates with combined ceftriaxone resistance and high-level azithromycin resistance were reported in 2018 in the UK and Australia. Advancing vaccine development for gonorrhea and the global STI vaccine roadmap efforts are underway to gain consensus on gonorrhea vaccine target populations, implementation strategies, and other preferred product characteristics that would make these vaccines well suitable for use in low and middle income countries as well as high income contexts. Neisseria gonorrhea vaccine development hope on the horizon. Neisseria gonorrhea and Neisseria meningitis share 80 to 90% homology of primary sequence, and thus some level of cross protection is plausible. A recent case control study in New Zealand, wherein group OB OMV meningococcal vaccine has been used for years, suggests a decrease in gonorrhea infection in those who have received this meningococcal vaccination. Expanding upon this platform would provide a template for a successful gonococcal vaccine or a broader Neisseria vaccine incorporating gonococcal antigens. And we have seen that during and after the use of this ZB mass vaccination, that is, it was a meningococcal vaccine in the New Zealand during a meningococcal outbreak between 2004 and 2006, there was observed to be a simultaneous decline in reported cases of gonorrhea as well. Effectiveness of a serogroup B outer membrane vesicle meningococcal vaccine against gonorrhea, a retrospective observational study. Declining antimicrobial susceptibility to current gonorrhea antibiotic treatment and indicate treatment options have raised the possibility of untreatable gonorrhea. So new prevention approaches such as vaccination are needed. Outer membrane vesicle meningococcal serogroup B vaccine might be protective against gonorrhea. For this purpose, they performed research that they evaluated the effectiveness of serogroup B meningococcal outer membrane vesicle vaccine against gonorrhea in individuals ages 16 to 23 in 2 US cities. And the findings were that those who had a complete vaccination against this meningococcal vaccine, they were 40% effective against gonorrhea, and partial vaccination series was 26% effective. So the interpretation was that men before C vaccination was associated with a reduced gonorrhea prevalence, and this could offer cross protection against this Neisseria gonorrhea. And development of effective gonococcal vaccine might be feasible with implications of gonorrhea prevention and control. Gonorrhea, latest antimicrobial global surveillance results and guidance for vaccine development published. The global health sector strategy on STIs has set targets for reducing incidence of Neisseria gonorrhea infection by 90% by 2030. And recognizing this, that the reduction may be difficult to achieve with available interventions, and given increasing antimicrobial resistance, the strategy has emphasized the need to develop effective gonococcal vaccines. And we have already gone through it, that no currently licensed gonococcal vaccine exists. Now time for MCQs. MCQ number 1. A 24-year-old man presents to the clinic requesting testing for STIs. He has a new female partner and is interested in making sure that he does not have any STIs. Currently has no genitourinary symptoms. Which one of the following diagnostic tests is the most sensitive for detection of urethral Neisseria gonorrhea infection in an asymptomatic male? Nucleic acid amplification test, gram stain of a urethral swab specimen, culture, methylene blue junction violet stain.
C.
No, A. NAT is the sensitive for detection of this infection in asymptomatic male. MCQ number 2. A 29-year-old male presents to the hospital with the pustular skin lesions and tenosynovitis. He is sexually active and he has been diagnosed twice before with gonorrhea. He is admitted to the hospital with a suspected diagnosis of disseminated gonococcal infection. Which one of the following is true regarding disseminated gonococcal infection? All patients with disseminated gonococcal infection should have evaluation with echocardiogram to rule out endocarditis. Oligoarticular arthritis is a frequent manifestation of disseminated gonococcal infection. All patients with disseminated gonococcal infection should have lesions with lumbar puncture, perihepatitis in 50% of patients.
B.
B? Yes, B is the right option. Although endocarditis, perihepatitis, these are also the manifestation of this disseminated infection, but this is the main, very frequent manifestation of the disseminated gonococcal infection because it consists of the triad, that is tenosynovitis, arthritis, dermatitis. MCQ number 3. Gonorrhea is second most frequently reported bacterial sexually transmitted infection after Chlamydia trachomatis. Which one of the following type of bacteria causes gonorrhea? Gram-positive diplococci, gram-positive bacilli, gram-negative diplococci, gram-negative bacilli. Any
A.
No, C is the right option. Gram-negative diplococci. MCQ number 4. Neisseria gonorrhea is an obligate human pathogen that commonly causes mucosal surface infections of male and female reproductive tracts. All of the following are the infections caused by Neisseria gonorrhea except genital gonorrhea in women, pelvic inflammatory disease in men, neonatal conjunctivitis, pharyngitis.
B.
Yes, B is the right option.
D.
MCQ number 5. Babies who have contracted gonorrhea of the eye from the infected mother have the disorder called pelvic inflammatory disease, cervicitis, pharyngeal gonorrhea, ophthalmia unitorum.
D.
Yes, D is the right option. MCQ number 6. People with gonorrhea commonly co-infected with chlamydia trachomatis. Which one of the following is treatment regimen for such patients as recommended by CDC? Single IM dose of ceftriaxone, oral 500 mg ceftriaxone for 7 days, single IM ceftriaxone shot along with oral doxycycline for 7 days, single dose of both ceftriaxone and azithromycin.
C.
C.
Yes, C is the right option. MCQ number 7. Gonorrhea is treated with antibiotics. What problem has occurred recently in the treatment? Antibiotics have been in short supply. The bacteria that cause gonorrhea have become resistant to certain antibiotics. People have developed an allergic reaction to certain antibiotics, intolerance and adverse reactions associated with antibiotics.
B.
Yes, B is the right option. MCQ number 8. Gonorrhea is becoming a public health problem due to treatment failure arising from antimicrobial resistance. The best way to combat this threat is prevention. Which of the following is not recommended regarding its prevention? Use of male contraceptive barrier, monogamous relationship with non-infected partner, vaccinating young people with Neisseria meningitidis vaccine, yearly screening of people with risk factors.
C.
Let's see. Because this is under trial and this is not recommended at the moment. MCQ number 9. A physician diagnoses gonorrhea in a 17-year-old female patient with painful urination and discharge. Which of the following are factors that may influence the recommended treatment regimen? She was treated 4 weeks ago, but symptoms did not improve. B. Whether or not she is pregnant. C. Number of partners. D. Number of gram-positive diplococci according to lab reports.
C.
No, A is the right option because this is showing treatment failure. So this is the factor that may influence the recommended treatment regimen. MCQ number 10. CDC recommends yearly screening of sexually active women and pregnant ladies for gonorrhea and chlamydia. The highest incidence of gonorrhea happens in which age group? 9 to 15, 55 to 65, 30 to 45, 15 to 24.
Delta.
Yes, D is the right option. This is the key. Thank you.
Okay, thank you very much, Dr. Meha. Very nice presentation. The first important thing that you have highlighted